Joe Biden presents his alternative to Medicare for all. Republicans work on their own health care plan. And Trump's "go back to where you come from" tweet sets off a firestorm.
Team Rising is here to figure it out. Stephen Cobb is a former Obama administration appointee. Previously served as Deputy Attorney General of Virginia. And Daniel Turner is the Executive Director of Power the Future. Gentlemen, welcome to you both.
Thank you.
So, let's start with the tweets. I'm not really sure where to say. I'll give you both your opportunity to talk about it. I'm going to assume we're all exasperated.
I guess we have to put them up, right?
Yeah. So we have the president tweeting, "So interesting to progressive Democratic congresswomen who originally came from countries whose governments are a complete and total catastrophe, the worst, most corrupt, inept anywhere in the world, if they even have a functioning government at all. Viciously, blah, blah, blah. Why don't they go back and help to fix the totally broken, crime-infested places from which they came?" Daniel, we'll start with you.
Yeah, this shows how toxic Twitter can be, right? I think maybe after a generation of reality TV and social media and now a Twitter policy, we're at the point that we can't say things intellectually. We can't have real serious debate and conversation. So I don't like Twitter to put out foreign policy ideas or domestic policy ideas, or to share your thoughts on other candidates. And I think we've devolved sometimes into a bad place for a conversation.
Stephen, this isn't about Twitter.
It's deplorable, it's racist, and it's not because Twitter limits you to a certain number of characters. It's because this is what the president thinks. And you could give him a podium and a microphone and he would go on ad nauseum, but the message would be the same. And it is reprehensible.
Well,
and it should be condemned across the aisle.
And I think everybody probably knows this at this point. And not that this is even the point, because even if these congresswomen did come from other countries, they are now Americans representing, duly elected Americans representing districts that they were elected to represent. And what is more American than being someone like Ilhan Omar, who was a refugee, who came here and, yes, is a critic of the current country, as anyone who is a good patriot should be looking always to improve the country. But it is worth saying that 3 of these congresswomen are not from other countries. They were born and raised here. I mean, AOC is from New York, not so far from where the president is from. She is of Puerto Rican descent. Puerto Rico, also, by the way, part
of the United States.
Of America.
Yeah. That is what annoyed me the most about this entire thing. Is it was like, you want to talk about Ilhan Omar? That's fine. We've talked about it last week. I think it's a legitimate debate about whether Ilhan Omar.
Well, and where did that come from?
From Tucker Carlson.
And you can draw a direct line between
Tucker didn't force him to tweet something stupid.
No. Look, Tucker is a media personality who says whatever he says. What I'm pointing out is it's ridiculous that the president takes some crazy white supremacist thread line from Tucker Carlson and expands on it to make it even worse.
I think
this is the debate. It's not white supremacist to criticize Ilhan Omar, who comes to this country as a refugee and says that we are fundamentally flawed as a nation. That is what I think the actual debate about here is does that represent the type of immigration that we want to encourage?
That's not what the tweets were about.
No, I'm not.
And now we're getting far afield.
This is not what the tweets are about.
The president is the master of distraction, and he doesn't mind having racist tweets in order to distract from his own poor record and from people who have very worthy policy critiques of him and his failed administration. And so he has no problem using racism to distract from that.
But this comes on the heel of AOC calling Nancy Pelosi racist. So everyone just calls each other racist all the time.
Okay, but
all we do is say you're racist, you criticize me, you're racist. We just go back and forth to racism.
Okay, but hold on. Isn't it legitimate to say that this is racist? To tell a person of color to go back where they came from is a racist thing to say.
It is as racist as AOC saying that Nancy Pelosi is racist for criticizing her.
No, and in the follow-up directly to that, they asked AOC if she was trying to say that Nancy Pelosi was racist, and she very clearly said no. So that's
I'm sure if he asked Trump if he thought he was racist, he'd say no too. But we should also talk about the Joe Biden healthcare plan, and this is policy I'd much rather debate here. So Joe Biden, he's released his new healthcare plan. It's essentially a redux of Obamacare. Wants to use the market system, bring back the individual mandate. That's the crux of how he believes we can reform healthcare in this country. Stephen, does that go far enough for the Democratic Party today?
I think that plan is much closer to the wide range of the support within the caucus and in the party electorate than the Medicaid for all.
Okay.
The Affordable Care Act was passed with wide support within the party. And what we're talking about, or what I believe the Vice President is talking about rather, is incremental change and ways to continue to improve and build on that.
Yeah.
And I think people look at that as not only a reasonable path forward, but one that's going to help a lot of people.
So Dan, before we get you in here, let's hear how the Vice President himself tried to sell it.
I believe we have to protect and build on Obamacare. That's why I proposed adding a public option to Obamacare as the best way to lower costs and cover everyone. You know, I know how hard it is to get that passed. I watched it. Starting over makes no sense to me at all.
This is truly the moderate case for not going for Medicare for all. He's trying to directly draw a line between himself and the Bernie Sanders wing of the party. Do you think that it'll actually work out for him?
I think someone has to somehow tread the middle ground on moderation when it comes to health care. Medicare for all is not a possible thing. It's not a feasible thing. But look, I think he has to own Obamacare. When I was starting my organization, Power the Future, I was unsalaried for almost a year. I was forced on Obamacare. I was paying almost $500 a month, and I had about a $5,000 deductible. And I have no dependents, and I have no illnesses. So if that is the best the Obamacare was going to give someone like me, who would possibly want to continue to support Obamacare? So Biden has to own this, because it is an absolute failure for people like me.
Stephen, here's the problem with what Biden is. Here's one of the problems with what Biden is saying, which is that he says, you know, I remember how hard it was to get Obamacare passed, and so we've got to build on that. Getting a public option passed at this point is no more feasible than actually getting Medicare for all, which is what the Democratic electorate says that they want. I mean, Medicare for all polls incredibly well, not just with liberals, but with moderate and even conservative Democrats in the primary. So why not this time actually go for the thing that people want, since all of it is going to be incredibly challenging to pull off?
I think it's about creating an infrastructure for the long-term longevity of such a program. And that we want to do these things incrementally in order to work out some of the bugs as it goes into implementing what would be a very...
We have Medicare for all. We have Medicare. It works well. People like it.
And if you're going to...
So what, what's easier to do than to expand something that's already working?
But if you're going to expand it to tens of millions of people, you don't do that with just a flip of the switch. There's infrastructure that goes into making sure that those payments are processed correctly. And so is a public option a stepping stone to Medicare for all? Is that the case you're making? I think it's, well, to use one of Bill Clinton's terms, a laboratory of democracy, to see how that works, to see how the public reacts to it, to see if it is providing the high level of care that people want from it, and then if it is working, then it potentially can be expanded further.
To me, what I don't understand is all politics is signaling. So saying I'm going to work in this highly elaborate legislative process to eventually get this. No, that's not what people want to hear. They want to hear, I'm going to get health care. That's it. That's why Medicare for all polls well. Nobody actually thinks that with a Republican Congress that Medicare for all is ever going to pass. It's a fantasy. So to me, what I don't understand about Biden's politics, Dan, is why he won't just say, yeah, I believe in Medicare for all. And I'll fight for it because I'm the guy who actually, if anyone was going to get most of it done, it would be me.
Yeah, I think it's interesting because he is leading so well in the polls. He's really got a command right now of all the other candidates. So he could come out with something as bold as saying, I'm going to push Medicare for all. I'm going to push some other policy. Someone like Elizabeth Warren, who puts out pretty bold and decisive policy decisions all the time, he could do that. And so the fact that he's not doing it, I think is interesting.
It's not going to work.
Well, and the incrementalism, I mean, in fairness, I think that's genuine. He is an incrementalist politician. That is core to who he is. So I think it's consistent with who he is. I just personally think it's the wrong approach.
Well, I mean, there's issues, I think, with the fiscal numbers that go to it, and they were highlighted by Senator Bennett in the first round of debates, and really, how that affects the hospitals, how that affects reimbursement rates, how that affects the pharmaceutical industry. Being able to do that big of a change that quickly, I think there's going to be additional repercussions both in the marketplace and in the consumer that you can't necessarily plan for. And that incremental approach allows...
I mean, certainly. What I would say is that the biggest challenge to something like Medicare for all is the money to the insurers, and Big Pharma would lose their minds, and are losing their minds over it even now with such a distant threat. So there's no doubt that those challenges are real. Stick with us. We're going to have, coming up, more with Daniel and Stephen. They're going to figure out all the rest of the things when we return.